20 years ago or 30 years ago, medical office spaces were designed to separate visually, but not necessarily from a sound or an acoustic point of view. And today we take walls all the way to the deck, put insulation in the walls, use solid core doors, put sound seals on doors so that we can have better patient privacy. Energy codes are changing. Buildings are becoming much more efficient. And the industry is moving away from fossil fuels to electrification of buildings. And we're working to make all of those things possible, not only in new buildings, but bringing some of that into existing buildings as well.
Welcome to Boston Real Estate Times. Our guest today is John Coker. He is a principal at Maugel DeStefano Architects. One of their expertise is healthcare, and John himself has been designing healthcare facilities for a very long time. We are going to talk to him about what is happening in the healthcare design today and what might happen in the next 10 years. John, welcome to our studio.
Thank you for having me.
Excellent. And looking forward to chatting about what is happening in the healthcare industry. But before you get into the trends, tell us about some of the projects which you further designed.
Sure. So we've designed projects for the last 30 years, as you started to say. It started as, single practitioner, MOBs or medical office tenants, to dental offices, and has grown to doing, full ground up MOBs, inpatient hospital work, operating room, surgical suites, as well as, LDRP suites, inpatient pharmacy compounding, all the various complexities that go into all the different services that go into hospitals.
And you have done a lot of work with a Sturdy Hospital as well.
So two of our big clients over the last 30 years has been Lowell General Hospital and Sturdy Memorial Hospital.
So what are some of the key trends? How is the architecture of healthcare facilities is today? What are the trends? What is happening in the design part?
I would say some of the big trends are trying to make the hospital environment feel more home-like. When I was a kid, I remember going into a hospital or a medical office building, and it was 4 walls. It was white. It was sterile, and it wasn't always inviting. We try and liven many of the spaces up. The pediatric offices that we do have fun colors. It's not just 4 walls. What can we do to make the space fun? Like they would be in school. While they're going in to visit the doctor. It's the same way in medical office buildings. You're trying to provide common area spaces that are inviting for patients to come in. Yes, when you get into a hospital, there's sterile operating rooms or things like that where we have technical requirements that we have to meet. But there's still your family members in the waiting room, and trying to make those spaces soft and inviting while you're waiting for the rest for your family member to.
So how is the technology, both medical technology as well as the day-to-day technology, changing are having an impact on designing healthcare facilities?
I would say it's adding a lot more infrastructure to the building. The operating rooms that we just designed for Sturdy included cameras in the booms and fiber optics all the way back to recording devices, so that the procedures can be recorded and documented as part of the patient's history as well.
What about in terms of the medical technology, like the size of the technology and all the new inventions are every day happening? How you are adjusting to that?
Sizes, I would say sizes of devices are getting smaller.
Mm-hmm.
MRIs are getting smaller, X-rays are getting smaller. Technology is changing, and it's gone all digital. X-rays used to have film rooms associated with them. Those rooms we can recapture and repurpose for other uses now, because X-rays have gone digital. It changes from a square footage requirement for the facilities into IT infrastructure cost to support those.
So those
spaces.
some of us who have visited the hospitals, either for ourselves or with friends or family, one of the nightmares I see is navigation and finding the place.
Always
So,
the case, yeah.
so to tell us about how that is changing, are the architects are really paying special attention to that?
Yeah. I would say it's kind of multifaceted. I mean, in a hospital, it might be color coding what some of the wings are, because hospitals grow and they grow to where they have lands, and land is limited, and so it doesn't always create an easy wayfinding path. And so we have to have good signage. We have to have probably different wings in different colors and things like that, so that different departments have different colors associated with them. So it's not just reading a sign; it's also a visual color difference to get there. Look, in a new building that we're designing, we're trying to create the easiest patient flow possible. You know, it's from the parking lot into the waiting room in an MOB, into the individual doctor suite, into their waiting rooms, a check-in process, back to where their examination is taking place. Do they have other labs that they need to get? What other things need to be close by? And then the checkout process, and what's their path back out of the building as well.
And what about the overall ambience, the environment? In the hospital setting, is it actually? I have noticed, because I was born and grew up in India, and it was a nightmare to go to the hospital because everything looked so scary.
Yeah.
And I worked for about 10 years in Latin America. Same experience. Hospital, oh my God! But here I have noticed that. And more I see that you go to the hospital, don't feel like you are in the hospital. It feels like more.
Waiting areas. If we can bring biophilic things in, like plants, into some of those areas. Look, we have to have flooring that can withstand blood and other things in those environments. But there's LVT products today that look like wood that you would have in your house. But they can be cleaned and washed and have the wear cycles that the hospitals demand.
So, John, two other things, if we can talk about. One is the flexibility of designing the healthcare facilities. How important is flexibility? And other one is the hospitality concept in healthcare. Does it exist there, or it is just a thought?
Okay. I'll start with the hospitality side. Look, I would say, waiting rooms aren't just a room for 50 people anymore, and individual chairs. We try and break down the scale of that room to create individual seating areas where a family can sit together. Some of it might be bench seating. Some of it might be some chairs, or you get into pediatrics, and maybe there's some play spaces for the kids or other family members that are there with you. In a hospital, in waiting room, in the lobbies, you are providing, a welcome center where you can help be guided through the hospital, but also areas where you can sit and be waiting for family members to be coming back from their visit as well.
And flexibility.
Yeah, flexibility. Procedures are always changing, right? So we're always looking at how we can design spaces that can be built once, but can also accommodate other new technology that comes out that may make the procedure more effective, or can the procedure be done in a more, let's say, office-like setting versus a hospital surgical type setting? Because one, that not only increases care for the patient, but it also reduces the cost for the patient as well.
What about if you go now moving forward, and if you get your crystal ball and you look at 10 years from now, do you think is there going to be any change in the demand for the healthcare facility, the style or design, or not much change you expect?
I would say that design always changes, right? You look at clothing styles, every decade there's new trends, and so hospitals are it's not just a service you're providing, but you are a destination that you're trying to bring your patients to. And so staying on those design trends and making it look like you're a modern facility from a branding perspective and design perspective helps. It's not just about the care, it's also about the experience that patients see when they come into your building as well.
And the last question, which is very important now, is, as you know, Massachusetts is trying to go, net zero by 2050. How the sustainability and environment are playing a role in healthcare facilities?
So in Massachusetts, we have some new energy codes that have come in the last year, it's not just the base national energy code anymore. There's a stretch energy code to increase the efficiency of all the buildings in Massachusetts, but then there is an opt-in energy code as well. Those codes are starting to decarbonize what hospitals are doing in terms of heat and steam and all of those things, and bring more electrification into their facilities. So I see potentially a need for, certainly in all new buildings, we have to design for those. And then I can see changes over the next 10 years for even existing buildings of what can we do to make the systems in a hospital more efficient and to help reduce operating costs.
What impact is having on the cost? That was my...
Well, in the short term, costs are going up. The new electrified systems between electric cars, charging stations, is creating a larger demand for electricity in buildings. And because of that, there's a temporary shortage right now in terms of supply for the equipment to supply those. So in the short term, I see that there's a cost increase. I would hope in the long term that as the utility companies catch up to that the cost will come back.
What is the newest project you have designed lately for the healthcare facilities?
Sure. The newest project is a 50,000 square foot medical office building in Needham. It's for Boston Development Group. It doesn't have any tenants yet. It is a flex medical office building that is for MOB purposes. So it's primary care, pediatrics, different diagnostics, follow-ups could be done at that site. It's not an outpatient surgical center, but it's basically everything underneath there. That building is one of the first that we've done that is going to be, because it's located in Needham, they're under the new opt-in energy code, and it's going to be an all-electric building. So that project will have no gas on to the site, and we are designing mechanical systems that are not just multi-zone systems, but where we might have heated with gas in the past, we're now using heat pumps to provide that heat source and cooling. If there is a limited device that needs to be gas, we will, as part of that code, are going to be providing future electrical service or future electrical capacity that as equipment changes from gas to electric, the building can easily be converted and changed to meet those upcoming. I've been with Maugel now for 25 years and have started from one or two medical tenant fit ups to growing our business to a healthcare practice that now supports a full studio. We've grown from the 1,000 square foot medical doctor's office that's going into an existing building to doing full scale master planning for hospitals now. Projects have ranged from brand new ground up medical office buildings where hospitals are consolidating different doctors' practices all into one location to minimize their real estate needs, but also to provide multiple types of care in one location that they can send their patients to and not have to go from building to building to get those in the suburbs. Hospital renovations where we're renovating ORs and pre and post-op surgery spaces, compounding pharmacies for inpatients, LDRP suites, all of those types of things that go into hospitals. So we not only do renovations to existing buildings, we've done a lot of ground up buildings for combining multiple practices, maybe under one hospital umbrella, into a single medical office building. Creates a single location for patients to go to for multiple services, where they can just go across the hall as opposed to go from building to building. A couple of examples of the new MOBs that we've done is we've done 3 different ground up MOBs for Lowell General Hospital and Circle Health, as well as one for Sturdy Memorial Hospital as well. In addition, we're currently designing a 50,000 square foot medical office building that is going to be leased to it's being developed by a developer, and we're currently looking for tenants for that building. At Maugel, we have a passion for healthcare design, and we're always looking for new clients, and we're here to have conversations with each of you to discover your needs, design buildings that embodies what those needs are, as well as the new trends that are coming out, and designing first-class facilities for you. So we're always open to entertaining new conversations with you.
Thank you so much, John.
Thank you.